Hello, everyone. As part of the Diabetes Awareness Month, I wanted to do a small recording on what happens when we are sick, a complication linked to type 1 diabetes, associated conditions, and eating disorders and diabetes burnout, which are more maybe psychological or psychiatric uh, disorders. This is content made by a patient, so I'm not a doctor, I'm not a medical staff, and this is based on my own understanding of those things, so they may not be scientifically or medically fully accurate. Sick days. What happens when we are sick? Type 1 diabetes is an autoimmune disease, so I understand our immune system may not be as efficient as it should be. This is probably one of the reasons we are part of the target group for the flu jab, even if we are not 60-year-old yet. What happens when we are sick is that often our glucose level or blood sugar level will get higher than what it should be or what it usually is, and it can really peak at very high level. So the main challenge, besides being sick and trying to rest, is to manage our glucose level, and it is not easy. To give an example, the only time I got the flu, and after that I did the flu jab every year, I was under a daily system of 2 insulin injections a day. At this time with the flu, I had to have an injection every 2 hours, which is much more than what I was used to have. So this means that one of the risks of being sick is that we can have a glucose level that peaks much too high for too long, and then we may land at the hospital for diabetic ketoacidosis, which is basically too much sugar in your body for too long but at a very high level, and this can be fatal. Complications. There are 3 things we have to have checked every year that can be linked to either unstable type 1 diabetes. Well, no type 1 diabetes is really stable, but you have people with much higher variation between their numbers than others, and this can affect the stability and can potentially lead to complications. Or people who have an average glucose level, which is what we call the HbA1c, and which is taken normally every 3 months, where through a blood sample, we calculate what is the average glucose level over the last 3 months. And it should be between a certain range, but sometimes it's higher than this range. So if it is too high for too long, it can lead to complication on the long term. Complication can affect the eyes. We can get blind, so we have to have our eyes checked every year. It can affect the nervous system. I don't really know why. And it can also affect the kidneys. So all those, the functioning of our eyes, our nerves, and our kidney have to be checked every year normally to track if there is any sign of damage and so potential complication in the long term, and try to I'm not sure for anything else than the eyes, but it is possible, but to reverse them or to stop them. Associated conditions. So type 1 diabetes is an autoimmune disease, so our immune system is not fully efficient, which means that it can be linked to other autoimmune disease. And insulin is a hormone, but it is missing in our body, so it can be linked to other autoimmune diseases, but also other hormonal conditions, some of them that can also be autoimmune disease as such. So for example, we can have hormonal dysfunction such as a problem with the thyroid, Hashimoto disease, which is a thyroid dysfunction, but I think it's different than the usual thyroid problems you hear about. And then polycystic ovary syndrome, which affects a woman, which basically can lead to infertility, facial hair, and irregular periods. Then you have other conditions like vitiligo. I haven't heard about a lot of people with vitiligo. I know some in France. You can have autoimmune gastritis, which is an inflammation of your stomach, and it can lead to anemia. So you need to have your iron check, because if it's too low and it's lasting, it may be created in fact by autoimmune gastritis. Then there is what we call diabetic gastroparesis, which my doctor says is having a lazy stomach, but basically your body, your digestive system takes much more time to absorb the nutrients you eat. And so it can have effects on your glucose level, because if you take sugar and it's not ingested as fast as you thought, and you did insulin based on the scheme you had in mind, it doesn't work. It can totally affect your glucose level. Then I will not speak about all of them because I do not know all of them. I think those are those I heard the most about, or I know. But I will try to publish a list, or to publish a link to a list. I think NHS did a good list. Celiac disease. Celiac disease is not a gluten intolerance or a gluten allergy. It's an autoimmune disease. Your small intestine gets damaged and destroyed by gluten. So you have to stop eating gluten. A lot of people think that a gluten-free diet is healthy and so on. Well, if I eat gluten-free pasta, it will have an effect on my sugar that no other carbs will have, because you compensate the taste that is missing from the gluten through sugar and other industrial stuff. And then you have a lot of gluten-free foods that are, we thought, that are not really healthy, such as chocolate or cheese. The problem with celiac disease is not so much cutting the gluten, is that if you go to a supermarket, most of the food that you think should be gluten-free because, it should not include any gluten. In fact, there is a lot of gluten inserted into it for the taste. So you have to check every label of everything you buy at the supermarket that is not just vegetables and fruits, which takes some time. Then eating disorders. So it is a challenging topic. I saw recently an article that said that there is a prevalence of eating disorders in type 1 diabetic people more than in other people of the population. I'm not sure food is really the problem in eating disorders, at least not from my own personal experience with eating disorders. I think it's more like you have an underlying problem, a depression, or in the case of some people, diabetes burnout. You have a lot of pressure. You have always to have your sugar in range. You have to be careful about everything you eat. You have to control your glucose level 5 times a day. You have to do a lot of injections. You have to be careful to what you eat and to calculate what will be the effect of the food you ingest on your glucose level and get the right insulin amount for that. You have to avoid low and highs. And then on top of that, if you have another condition such as celiac disease, type 1 diabetes is not really the problem about what you eat, but celiac disease will remove a lot of ingredients from your food, so it's not easy to manage. So the problem with food is what people see when we speak about eating disorders. I'm not sure the food is really the problem. I also do not believe you choose to have eating disorders. You have some parameters that foster the development of an eating disorder in a person. What is really difficult to get over eating disorders is that you are fighting alone against yourself. You can have the best doctor, but in the end, it all relies on yourself fighting against a voice in your head, or against pulsions you may have, or against this eating disorder that tells you that you should not do this, or you should not do that, or you should do this, or you should do that. It's not easy. And I think in some cases eating disorders are linked to either a feeling that you lose control of everything in your life, and so the only thing you can control is what you eat. For some people, it may be linked to depression, and I would not be surprised if, in the case of certain people, it's linked to diabetes burnout. A diabetes burnout happens when basically you feel burnout by all the control you have on your diabetes. So I never saw type 1 diabetes as something that prevents me from eating anything. It's different from celiac disease or from a food allergy or intolerance. But there is a lot you have to check in your days. So for me, it's part of my daily habits. I have to brush my teeth, I have to brush my hair, I have to control my diabetes, to check my glucose, to do my injections. But I can understand that for some people it's too much, because especially if you did not grow up with type 1 diabetes, but you get diagnosed much later in life and you knew life without all those constraints, which for me are part of my life, but for some people are difficult to integrate in your life. And we never have any holidays from all those checks and controls we have to do. So some people may just feel totally burnout with it and feel totally overwhelmed with it. And it may be a separate condition, but I would not be surprised if it's linked to any eating disorders. There is one eating disorder that is specific to type 1 diabetes, next to anorexia and bulimia. It's diabulimia, which means that a type 1 diabetic person stops injecting himself or herself insulin in order to, well, I think to lose weight, but not really sure. This is really dangerous because we need insulin to live. It's like water for us. And even if you do not eat, you need insulin. So this can land people in the hospital, and it may even be fatal, because if you do not take insulin for too long, your glucose level will be too high, and you may have a diabetic ketoacidosis. So it is not really easy to manage any of those conditions. And it may not be linked to food directly, but more to underlying problems. This is what I feel when I look back to my own experience with it. And I would really love to see what is done in terms of research and supporting patients to avoid that they get into that.